All right, so you guys want to grab a seat too, or? All right. Well, Mayor, thank you. Mayor reached out about looking in the barber shops and the salons. We just so you know, we have been working with my task force on figuring out what type of safety would be necessary. So they have been talking with folks, working on talking with some medical, working on guidance. But obviously, we wanted to solicit feedback from people who do this about what would you be thinking, how do you do it in a way that reduces, that makes the risk small. Because at the end of the day, you know, if you're doing things that are safe and the risk is small, you have a right to apply your craft. And so we want to get to yes. We want to be judicious and methodical and be safe about it. But I think that we have an opportunity to do it. Can we just go around, introduce, and maybe just say a few things? I'll kick it off, pass it over to the mayor, and then we just engage in a discussion about what we're going to do. Go ahead.
Role Health Officer for the county.
You guys have done a great job. I want to thank you for all your hard work. You look at Orange County, no, both of you, you look at Orange County's, how they've weathered this. I don't think anyone would have predicted what has happened. I mean, it's just been really good. But you guys at the health department have done great, so thank you.
Yeah, well, we're not expecting it, but yeah, it has gone very well. So it has been gratifying to see that your plan is measured, has different steps, and you also have the ability to consume the data and see how it's reported. It is, you know, we had some concerns at the beginning before everyone developed any plans, because part of this pandemic is what we're trying to explain to people. It's not this worse or better or anything, it's the speed at which it can speed. And we have to avoid overwhelming the healthcare system, which has not happened, fortunately for us. So we are extremely happy to see a plan that have different steps. We have engaged in conversations with many of the members of the task force and the industry. They will tell you that they are willing to take extraordinary steps to reduce that transmission that you're making.
Great. Yes, sir.
Good afternoon. Mike Vanderbilt, Mosaic Hair Studio. I'm one of the task force members. I do appreciate you taking the time with your family when you want to come out here and listen to a discussion from the industry. A couple of points I'd like to make. We are all trained, licensed to train. State of Florida certifies us through training. I think if you just look around this salon, and these are all protocol steps that are normal on a regular daily basis for licensed stylists. So I know that during the grand opening, we'll all be taking measured steps, calculated steps to reopen. In fact, I've created a video for our staff. If you'd like to see it, I'd be more than happy to share it with you. It's really about hand washing. We've purchased a sink in front of our salon. We're asking all clients before they enter to come in. We're doing social distancing scheduling, which I believe all salons are currently doing now. So that means no double booking. So one client at a time, no one in between while someone's color is processing. We've removed any items that can be touched. We're asking no one to touch the products. We've removed the candy jars. We've upgraded the sanitation practices, our tools implementation, the cleaning of the stations. I really feel that between the guidance that we've received from Dr. Rawls and between the mask, hand washing, really focusing on being brilliant at the basics, I think our industry is definitely ready to open up.
Great. Thank you.
Hi, first welcome to our salon.
Sure.
My husband and I own the
It's
salon.
very clean. I mean, like, it's as much cleaner than being in like most people's homes. So you do a good job.
So welcome to our salon. We've been here for 2 years, and we take a lot of pride in our salon and our staff and our clients. We've taken every measure, even before this happened, to ensure that everyone's safe. But after the fact, just to piggyback off of what he said, we have hand sanitizer by the dozens in here. We have a manufacturer here in Orlando that supplies it to us, so it's always readily available. We've even gone a step further to order disposable capes, so it's never touching again. We have a mask in the front just in case someone doesn't bring one in. We've supplied masks to all of our stylists. Our biggest thing is we don't want to just keep ourselves safe. I don't want to just keep the staff safe and their families. We love our clients. Those are like an extended portion of our family, so we want to keep them safe. Like you said, we follow sanitization guidelines in order to get your license. So in order to keep it, you want to be able to not get a lawsuit and all this other stuff. You want to make sure that you do exactly what you're supposed to do. So we have our stylists in here coming in on a scattered schedule. So not just a full salon, because all of our stations are taken up. We have a Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, one client at a time. And once that client is done, they have to sanitize. We have sanitization of the shampoo bowls. We've even gone a step further. We got contactless soap for their hands, the dryers, even though that's not what we normally do. We want to make sure everyone is safe. We're professional enough to protect ourselves and our clients. We just want the opportunity. We're not getting the help that we need because it's so exacerbated already. We just want the opportunity to help ourselves. And we've been doing this our whole entire career. We just want to be able to continue to do it.
Okay, well, thanks for having us. Really appreciate it. Hi.
Hi, my name is Mary So. I'm the CEO of the MC Spa, and I've been in the Orange County for over 27 years, opened the business here. What happened right now is bring it up to very important for all the licensed who are professional in the what we already been doing professional and get the license, but in the other side, I already tried to put all together with the guideline for even the customer, from the employer. We have two guidelines for what the product that we got, what is the tool, the clean up all the store, and I have everything. I put in the guideline. I will give to you later. It's a little bit about, so you have an idea what is the nail salon, make the customer or make their employee or even their community safe. So I put everything in here, and I will get a chance to show you a little bit later what do we going to do. When the customer walk into the door, what are you going to do? How do you guide them? How do you talk to them? Walk into, how do you serve it them? Before serve it, during serve it, after the service, and with the, everybody have their different thing to do. The owner, the manager, the receptionist, the worker, technician. For all, everybody have to be a team and well trained before we open. So as soon as if you let all the open, so we have at least for a couple of days retrain and make sure that everybody know exactly what they do and follow what the doctor or the CBD or the doctor or from the state. So
Great. Well, thank you so much. I look forward to reviewing that. Yes, sir.
Thanks
Welcome.
for having me.
Yeah.
My name is Jay Henry. I own a barbershop here in downtown Orlando. I'm a native of Orlando. Thank you, Mayor, for giving me the opportunity to be on the Economic Task Force along with my other friends. The doctors are here. And I think that we all are somewhat speaking the same language and having the same kind of concerns. I would first like to start off with the fact that I've been in the business for over 36 long years. We all in this profession have been trained from day one that we got to be clean and make sure we take care of ourselves, our family, our coworkers, and our clients. One thing that I really, really enjoy about being in this profession, it has to be a gift that was birthed into you before you get into this profession to bring you into the profession, first of all. And once you learn to be clean, safe, and continue to keep your environment safe, that's very, very important. Having said that, most barbers and stylists and nail techs, this is second nature to us, along with all the other type of advice that we're getting from the professionals. It helps enhance the things that we've already done. You know as well that inspectors come in the barbershop and hair salons all the time. We used to this kind of stuff. So having said that, we want to continue to govern ourselves accordingly, do the right thing, get back to work, but get back to work safe. Having said that as well, we want to make sure that, and I can speak for all barbershops and hair salons, getting the professional support or the finances, if you will, that we need. That'll be another conversation later, but we need that so we won't compromise the principles and guidelines that are put in place. Because right now, we're all dealing with this financial setback, if you will, in this profession. So having said that, once you all, as the governor, help empower the business owners in this profession with the support that they need from the government, financial support, with the loans and grants and all these different types of things, it'll kind of help us keep things balanced. Because once we get back to work, we're gonna need the money to stay in business, because we're in the red, but it'll keep us from forcing people to come in the barbershop, so we have a large overcapacity. So I'm sure you kind of somewhat get my point.
Yeah.
Thank you for having me.
Oh, absolutely. Thank you.
Well, Governor, let me just welcome you here to Orange County, to the greater Orlando area. You heard from many of our business owners here. I've known Nadine for quite a number of years, and John Henry, we went to high school together, although I was a couple of years ahead of John Henry, but I know
Which
them
school?
to be Jones High School here in Orlando. Jones High School, the Tigers. And let me just say that after listening to some of the impassioned pleas from the ownership group here as part of our Economic Recovery Task Force, they convinced me that they were able to open with the right sanitary measures in place, and you've heard them talk about that repeatedly here today. So I do believe that as we balance the reopening with the need for safety in our community, this is one of those areas that I believe they can do it. I have no concern about whether they can do it safely or not. And so I know that's important to you, is that as we reopen Florida, the businesses have to have a number of safety measures in place. And so they have shared with me a number of things that would allow them to do it. So thank you for coming. Thank you for hearing us out. Here within the region, we have tried to take a regional approach as we reopen. So I'm one of the few elected countywide mayors in Florida, but I have reached out to the county chairs in the surrounding counties, and we were pretty much in agreement about how we move forward with the reopening. And the Economic Recovery Task Force that we have in place has a regional outlook, and they consistently have said that they believe that this is the right balance here as we move forward. I'm guided by the physicians that you see here. Dr. Pino is the state health officer here at Orange County, a phenomenal individual. He has just been wonderful to work with as we have dealt with the pandemic. And Dr. Rawls, I've worked with, he is a senior official with Orlando Health, and you're very familiar with them. He's formerly the Director of Public Safety for the county itself, and he understands the county government as well. And so with that, they are my principal advisors, and everything that they've said to me is that they felt like there's a way for this to be able to move forward and to do so safely. So again, thank you for being here.
So you, as we look at this, I mean, when we approached our task force for the next steps for Florida, my instructions was to them is, as we look at the economy, this idea of essential versus non-essential is what had been done by, I don't know if that's public health over the years. So that was kind of the framework we were looking in. And as we were going down that road, it became clear to me that that was simply inadequate, because if this is your business, it sure as heck is essential to you. And if you have a job in one of these industries that some government official says is non-essential, I'm pretty sure you think that's essential too. So what we said is, I'm not going to sit there and say this is important and that's not. What we want to do is, if you have something like these personal services, what's the risk level, and is there a way we can lower the risk level? And if you make things that are low risk, people have a right to ply their trade and make a living. And that's the approach we've taken. Now, they have gotten into this on my task force, had started to do. We weren't quite ready when we did the original announcement, but this is something that we're interested in. So can you just talk about, from a medical perspective, are there things that they can do to make this, someone coming in and getting their hair done, to be low risk?
Sure, thanks, Governor. Absolutely, I think this is a good example of a well-regulated industry. These are professionals that are used to really high sanitary practice expectations. I think there's great physical space opportunities here. As you can see, a place like this, you have 6 feet between each chair pretty much automatically. And you also have a lot of awareness about client movement. They know how to schedule. They know what type of adjustments to make there. There are going to be some things that I think are certainly going to be different, like masking. And this could be, we talked about mandatory masking versus expecting people to do that. This might be an environment where you say our clients need to be masked, and they might know that need to know that when they schedule. If you come in for a session, you'll need to wear a mask. This is also maybe an environment we have some additional cleaning and sanitation expectations. We're hearing from Nadine that was already part of the plan. So again, I think a group of business owners that we should expect is going to do the right things, because I think for the most part that's happening every day already. And I just want to add one other thing, Governor. I think as you and the mayor are making these difficult policy decisions, I think it's important to point out to the patrons of these businesses, they have an expectation too. As community members, we have to be responsible. We should not come to a salon if we're sick. Stay home. If you're asked to wash your hands, wash your hands. If you're asked to wear a mask, understand why they're doing that. They're asking you to help protect them so that they can protect this economy and this community. So absolutely think we can do this safely, and I absolutely agree with the mayor on that.
Great. Now, you probably have some clients that are chomping at the bit to get in here, right, I'd imagine? Yeah? Yeah, yeah.
The pressure's high.
So I think you guys have talked about some stuff. So do you all agree that having the stylist wear facial covering would be fine, and that would be smart, and then you'd also provide that for the client that comes in? I mean, many of them probably already have masks, but if they don't, you think providing that option would make sense?
Totally, that's a very common sense approach. Like I've seen several businesses that are still open where they require you to wear a mask going in. This would be no different walking in wearing a mask. So I feel that's very reasonable and doable. And I know plenty of clients have been sewing masks. They're available on it. Their masks are definitely, cloth masks are definitely available to the general public. They don't have to be the big full N90, whatever the high-tech ones are. So clients are wanting to wear masks coming in. Prior to the shutdown, we had already taken lots of precautions and lots of steps as we were kind of gearing up. And clients thanked us. I'm sure you all had clients that thanked you for already stepping up the sanitation levels. In this industry, there's one thing that will really ruin you quickly, and that's online reviews. We all know the power of nobody in this industry wants a terrible Google or Yelp review about inferior sanitation right now. I can guarantee you everyone is doing everything and then some to make sure that when the clients do return, that we'll all be really ready to go.
Do we, because obviously salons are open January, February, most of March, and maybe Dr. Pino, but is there any evidence that there was actually an outbreak that ever emanated from a salon in Central Florida that we know?
Not in Orange County.
I would like to add
Yep.
that for us, wearing a mask is not optional.
Okay.
That is our normal, our new normal.
Yep.
And the fact of the matter is that the old normal, we have to put that aside, and we have to be able to guide our clients to be able to say, this is what's the requirement in this establishment. It's not a choice, because we have other people to protect, not just you. And so the fact of the matter is because these are our babies. It's important to have these things in place anyway. And we have to make sure they do it, because we don't want it to happen again. Our families depend on us. And when you said this is essential, it is essential. And we have essential workers going to work, not looking so essential. You know, they're not looking their best, and that's what we provide. And truthfully, hair salons and barbershops, those are the main arteries of a lot of our communities. And once you cut that, we could bleed out financially, and that's not okay for us. And we don't want to go to someone's home and say, okay, I'll just do you off the grid. I don't want to do that, because that's not the proper example. But what do we do when we're faced between that and feeding our children?
Oh, no, I get it. And not only that, but I mean, I don't know if you notice, like, there'll be people that are like talking heads on TV that'll say, you can't open everything up, and yet they've been doing this for 6 weeks and their hair always looks good. How does that magically happen? So you can't open your shop, but they somehow always have good hair. I mean, I haven't had a haircut in 2 months. Not that that's the important thing, but I mean, I'm coming on like a mullet almost with how much my hair's grown. So like, you know, but somehow people do that. So yeah, no, it's crazy. So in terms of like, obviously, when you come here, people, it's a time to kind of socialize. People see it's a fun time. Barbershops. So how are you going to be able to manage that? Are you going to just limit the entry? Because I imagine normally you'd have some people just kind of hanging out and having fun. There's nothing wrong with that. But if you're trying to reduce density, are you going to do, like at the barbershop, just appointments? Are you going to have people wait outside if they're waiting? How have you thought about that?
Well, see, the plan is, I thought about just like the driver's license office. I have a sign-in list. have a person sign in with their cell phone. Once they come to the barbershop, if they're sitting out in their car, we can text them or call them and say, hey, it's your time. They can come on in the barbershop and get their hair cut and keep it moving. Because one thing we want to keep in mind, saving lives is more important to me and all of us than making money. Of course, we need to make money, but we got to be able to live and be healthy in order to make the money.
Sure.
To continue to take care of ourselves and our families and one another. Having said that, all of us collectively know as hairstylists, most of the people, the clientele that come into the barbershops and hair salons, they basically already know the standards of that particular salon, of that particular barbershop. That's one of the major reasons why they go to that barbershop. Like in my barbershop, and I'm getting a plug right now, I don't allow profanity in my barbershop. Please cover your underwear when you walk through the door. These different types of things that we in this profession have always had in place long before the coronavirus came into effect. That's what kept us in business, those little small things that meant so much to other people. So we thrive on continuing to do the things that we've always done along with the new changes that are taking place. So it's normal and natural for us as stylists and barbers.
To address your concern, Governor, about kind of congregating an entourage, which every salon, regardless of community, has. We've all asked our clients, please, one person at a time, leave your entourage at home. We're doing exactly like Jay Henry's Barbershop. Now, we work mainly off of appointments, so it might be a recommendation that salons that tend to be more on the walk-in side maybe use an appointment system so people don't congregate at the front. And we've asked clients, when you do arrive for your appointment, please stay in your car, call us, and when we're ready for you, we will call you, and then you can come on in. So we're really client or crowd management is what we're doing through our scheduling book. The way she's doing it by having different shifts and whatnot limits the number of people that come in at any one time, and by scheduling and using appointment systems, we can definitely do that.
One of the things we've noticed, I think the data has been overwhelming really from the beginning of this, is different age groups are at different risk from this. So if you look in Florida, I think we're between 80 and 85% of the deaths have been 65 and up. And even as you get into 75 and up, the rate goes higher. So is there a need to do anything special for seniors, or do you think the same procedures would just work across the board? And I'm not saying you would need to do anything special, because I think what you're doing seems like it would be safe, but it's just something we probably need to think about.
I definitely think that is something that's imperative. So even though we're normally closed Sunday and Mondays, those would be the days to be able to say, listen, these are the days we're going to cater to only you.
Yeah.
Because they're important. Those are our grandmothers, our parents, our great-grandmothers. Those are people that I love. And so it's important to take care of them. I was raised to take care of my elderly, and so that's just what it is. It's going to be a sacrifice for everyone. So it's like he said, it's not just about the money. We care about our clients and anyone that's underneath our roof. And so the standard is Sunday and Monday, that's your day. Come in here and get taken care of, because you want to be beautiful too. You want to get your hair cut too. Our clients are, my phone is ringing off the hook. And it's my elderly client. When can I come in for my roller set? And so you want to be able to do it. You just have to be able, just like any other store is taking care of them. We don't want them to be ran over. We want them to be taken care of.
So Nadine, let me ask you this.
Sure.
At what age would you start the seniors at? Is that like 60?
That day seems like it would be anyone that is, first of all, pre-existing conditions would be those people that we would assume along with the people that are elderly.
Sure.
So if someone is younger and they may have gray hair like myself, you know, they can come in as well. Right. But I'm assuming that anything that collects AARP 65.
I think that's smart what you're thinking about doing, because I mean, just the bottom line is, you have somebody, you know, I'm 41 like me. If I were to get it in a barber shop, it's not, the risk for me is low. But then it would be, I may not even know I have it, and then if I pass it along to someone in one of the at-risk groups, and obviously we're taking the social distance, but just generally speaking, if you have somebody in that, when you have somebody who's in the at-risk group, then obviously if they were to get it themselves, we're not as, it's not like they're going to transmit it as the big fear. It's what will happen to them. So I think that's a great idea, and that may be some type of best practice that we could think about going. You were going to say?
That's exactly. A lot of these issues that you're bringing up can be addressed literally by proper scheduling. And I know a lot of salons. We are obsessive about our book, our scheduling, because nobody wants to feel the pressure of having a. So salons are used to client management and scheduling, and in this case, we're dealing with the at-risk. We know who our clients are. We know who the elderly are, who are at-risk clients. We've had a relationship with them. We know their life history. We know their drama. The reason they're 6 feet is not for social distancing. It's so the other person doesn't hear the drama that's going on, right? So salons have already policies in place to account for anyone who is at high risk. And of course, we love our clients, and we would do anything like opening up on days off to accommodate them.
So is there anything else we're missing, or what else do you think we need? Because I think what we'd like to do is, obviously this has been helpful. We'll take your recommendations. I've had folks working on this as well. We'll talk with the mayor about any other folks that he's had that's been helpful, and try to get a set of best practices, and maybe we'll run it through the cosmetology board or the barber board, and if it vets and it's safe, then I think we have a responsibility to get the yes on this stuff. And at the end of the day, we need to go ahead safe. I mean, our mantra is safe, smart, step by step, be very methodical, data driven, but having healthy small businesses is important to be able to fight any health problems, because if the society's not functioning, our ability to deal with this is not going to be as strong. You also have all kind of other health. I mean, this virus is not the only health issue that we deal with as our society. I mean, we have mental health. We have other things. We have fear that's permeated our society, such that people have significant heart pains, stroke symptoms. They're not even going into the hospitals now because they're scared they're going to get the virus and die, when the heart is much more of a risk for them. So I think it's obviously we want you guys to be able to be solvent and be successful again. But then I just think also just having things like this, I think confidence, people see, oh yeah, you're able to go in and get your hair cut again. It's a step towards a more healthy society. So I think it's important that we deal with this. I think we're going to deal with it in a way that's safe, of course, but I think we've got to. We are very creative people in Florida. Don't tell me we can't figure out a way to do things safely. And I know you all are committed to that. Yes, sir.
I just want to continue to add this, because I've got a lot of questions about this. And it sounds like a broken record coming from me, but I got to talk about it because it's on my mind and a lot of people's mind that I know. Small business owners that apply for the PPP loans and grants and stuff, none of us have heard anything. Okay. Anything. And I think it's very, very important that we don't overlook this. Going back to work is great, because that's what we've always done, all of our careers. But trying to hold things together, how, when, where, who to talk to about getting connected to the small business owners that do not know how much longer that their business will hold on, even if we start working today. If you lift the ban today, hey guys, you guys can go back to work today. Yeah, but I know the silent echo of what am I going to do with all these bills that are piled up since I've been out of work. So I want to continue to press on that, because I know it's for a good cause and a great purpose for all of us, that we need to get connected to these loans and these funds that are available, that the people in this profession, and not only in my profession, all over the country and in this state as well, that you're the governor of. You got to get connected to these loans and these grants so we can kind of empower these businesses to stay alive. Having said that, us business owners, if we know that we've gotten connected to some funds that are on the way, it's easy to stay connected to one client at a time, one appointment at a time, because I got something to hold me together until this curve flatten a lot more, and we can keep clients out of the barbershop or out of the hair salons trying to make the
You
money
applied
back.
for PPP?
Yes, I did.
Okay, so PPP, I think you guys, but it's a federal program. So I've been Senator Rubio was really instrumental of it. I've been working with him on it. I think the goal of it was you're basically stopping the economy, at least portions of the economy. And so what are you going to do? And so the idea is to provide a loan, but it's a forgivable loan, particularly for small business. What you saw, a lot of the bigger companies were getting the money.
That's what we talked
So they ran out of money. Some of the big companies are giving it back. They replenished it. There's still been some issues with it. But what I think I may do is maybe have him do something for Floridians, like try to put out some more information. Maybe we'll do an event to do it because what we did at the state level was we knew PPP was coming. The Congress was talking about it, but we did a $50 million bridge loan program. Now, under the law, I can't just forgive that, but it's an extremely low interest loan, very flexible. And that, people took that. I mean, we ran out of money on that, and so we're going to see after PPP is exhausted, we need to do something at the state level. I mean, I want to do it. You need the PPP. You're the exact person that this was supposed to be for. And so we're gonna work with the federal government. I mean, I fortunately am able, I know all the folks in the administration, Secretary Mnuchin, all these folks. They want to get it right. This was not an easy thing to put together just overnight, because you go back February, no one thought that we were going to be doing this when you got towards the end of March. So it got done, and so we are where we are in it. But yeah, I think the small businesses are really the ones that need it. I mean, the good thing is you don't even need as much money. I mean, the big companies, they're taking out tens of millions of dollars. Just a small amount of money will go huge. It'll help a business stay solvent, help the employees, and all that stuff. So I think it's really important. So I'm gonna work with. I've talked with Rubio a lot, and this is his passion is. So we need to make sure everyone's got the information, and there's definitely some administrative issues with it, because it's such a big amount of money, but I think we got to get there. And then once we figure out, okay, who definitely qualifies or doesn't, or the money run out, then at the state level, we can then look at some of ours. Then we don't have the ability to charge us on the credit card like the federal government, so we'd have to prioritize. But I do think it's important as we get the economic base back. The small businesses are the engine. I mean, we've had the big companies have been running the whole time, most of them. I mean, a lot of the healthcare companies, obviously, health insurance, utilities, all this stuff. They're all considered essential. Defense, the space stuff on the Space Coast, all of it. And that's important, and there's a lot of good jobs there. But if you look, most of the jobs are connected to smaller businesses. And so we've absolutely got to keep them going.
Thank you.
And Governor, I wanted to share something that we're doing here within Orange County. As we have listened to some of the small businesses that have been given the green light to reopen, and if you make the decision that the hair salons, et cetera, will reopen, we wanted to make certain that we have the ability to provide them with all of the different sanitary pieces that they need to be able to reopen. So we are the recipients here within Orange County of about $243 million in CARES Act funds to do a number of things.
Great.
But one of the things that we have done is Orange County has purchased about 1 million masks and then about 200,000 pieces of hand sanitizer that we will hope to receive shipment this week coming up. And we will, for those businesses who have not been able to access the supply chain for those types of pieces of protective equipment, we're going to provide that to them so that they can open in a safe manner. So I just wanted you to understand that we're trying to look at this holistically to get our small businesses back up and running to the extent we can. And I stay on the good side of Dr. Pino and the Department of Health as well.
Yeah, no, I think it's great that you guys are getting those funds. I know we have a handful of counties in Florida that qualified. The way they did the criteria, only one city in Florida qualifies, Jacksonville, because you had to be over a certain amount. So you have Dade County, Broward, Orange, some of our bigger counties, which I think will be helpful. And then we have some CARES Act money too, which can be used, and we're looking at ways you can use it for some of the economic assistance to businesses. So we may be able to, there may be some room to do some of that stuff. Because we have not seen hospitals overrun or any of that, we're just, in point of fact, not going to have to use that money for as much help as I think people initially thought. We set up I mean, we had field hospitals ready in all kinds of places. Miami Beach Convention Center, the Army Corps called me, like, hey, do you need anything? I'm like, I don't think so, but you know, what do you do? He's like, well, I'll build you a field hospital. I'm like, all right, let's go to Miami. So they built it there. No one's using it. I mean, it's like Miami, I think, had 45% of its ICU beds were not being used. So in terms of that flattened curve, don't let the hospitals overwhelmed, you know, I think we're in a pretty good spot there. So some of this stuff really can be used. Okay, the virus has dislocated a lot of parts of the economy. You know, let's figure out if there's ways that we can get it back. But I think at the end of the day, it's not a matter of if, it's just a matter of when with the salons. We just want to be very judicious. We always want to consult with medical folks and want to make sure that safety's first. But as I was thinking about it, no one's going to care more about safety than the people that own these places. I mean, it's just you have to do it. It's very important for you. It's in your interest to do it. And I'm confident that that a lot of you guys are going to do the right thing. So we're going to get there. We'll take your recommendations. We'll take what we did today, and I'll have some of my task force folks work on it. But we've got to get there. So you have my commitment to work to get there.
Appreciate it.
Yeah.
Very
Yeah.
Very good, very
I
good.
get it.
Set up the podium and then get the press conference.
Okay, good.
Good. Everybody, make sure everybody's smiling. Good. Stay there. Smile again. No blinkers. Hold on. And now, if you want, you can take your mat. If you just, everybody, just make sure
space
you're
out a
6
little bit,
feet
guys.
away.
Yep.
Come 6 feet away,
Stagger a little bit.
like we're ready for calisthenics. Pick your favorite politician. Good. A little bit of smile. There we go. Thank you all.
All right.
All right.
And let's make sure we social distance when we're around the podium. Yep, so I'm gonna move these chairs back. Move the birthday chair might be a little bit further. That's the birthday chair. If you guys just wanna.
Is everybody ready? Is everybody where they need to be here with the?
I think so. Chelsea, we got media. Media ready?
We good to go? Okay. Great. Well, good afternoon. It's great to be in Orange County. I want to thank Mayor Demings for reaching out about the barbers and the salons, very important part of our economy. The discussion was great. We were trying to just do things in a way that's safe, smart, step by step. This is something my task force had been discussing. We did not roll it out in phase one, but that does not mean we're not intent on getting to yes on this. I think the ideas that we heard were great. I'm going to be receiving some written product. We've got folks that have been consulting with physicians who've been working with written product as well. And, you know, I'm confident that it's not a matter of if, just a matter of when. But we got to get there. We got to make sure it's safe and sound and everything's good. I think part of the reason we're able to have the discussion is because we've seen a great amount of success throughout the state, but particularly here in Orange County. And I think the county health department, I think the mayor, I think all the folks who've been involved with that deserve a lot of credit. But also statewide, as of last night, Florida had 581 COVID patients in the ICU statewide. That's the lowest that we've had in a month. And for a state of almost 22 million people, that's obviously a very, very small number of patients. Here in Orange County, 1.5 million people. You have 21 COVID patients in the ICU. In Orange County, as of last night, 51% of the ICU beds were available and were empty. And so you've not seen the hospitals here get overwhelmed, not even close. In fact, we're part of phase 1 on Monday. We're unlocking these elective medical procedures because they have so much space in the hospitals, and people really do need to be getting these procedures. In terms of ventilators, we're down to the number of patients on ventilators has steadily declined over the past several weeks. We're now at 356 patients statewide that are on ventilators. There are 6,361 ventilators that are unused and idle in the state of Florida. And so there's not going to be any lack of ventilators for anybody, and that's very, very important. Testing, yesterday I was in Pensacola to roll out a new test site. As we do phase 1, we believe we need to be testing even more. And we have been doing a lot of robust testing. We got almost 20,000 test results back yesterday. We've been consistently in like the 15,000 a day. We'd like to get more, but I would say part of it is we have some of these drive-through sites in different parts of the state, and our capacity does exceed the demand in many parts of the state. I think here we've had a good drive-through site that they've had pretty consistent traffic, which is good. But if you look at yesterday's test results, there was 723 new Florida cases out of almost 19,000 total test results. So that's a positivity rate of 4.1%. And if you look over the last 10 days, the positivity rate in the state of Florida has been between 6.1% and 4.1%. Just to put that in perspective, I think the national average is between 15 and 20%. If you go to places like New Jersey, they're 45% of everyone who takes a test tests positive. So here in Florida, we're pretty consistently about a 95% negative rate for test takers. And Orange County, I think in particular, yesterday's test results, they had 18 new cases, but that was out of almost 1,760 tests. So the positivity rate in Orange County yesterday was 1%. And if you look over the last 2 weeks, they've been usually in that 1 or 2% range. I think that there may have been one day, actually, one day was 4%. They had one day at 4%, which most places in the country would kill to have that. But then you're at 1 or 2%. And so I think if you look, one of the great stories is a community that has more traffic coming into it from everywhere in the world and the United States. There's no way you can have a pathogen circulating anywhere and it not end up in Central Florida with the tourism, with the number of people in our country that come here from various states. And so to have numbers like that, you look at all the indicators such as the surveillance data for hospitals, the syndromatic indicators. You've seen really good declines in Orange County for cough-associated admissions. I think cough-associated admissions now are lower than they've been all year in Orange County, even with the pandemic still going on. ILI has gone down. COVID-like illnesses has gone down. So this is a great story here. And I think as Orange County and the rest of Central Florida has done such a great job battling this, I think they're going to be really part of the foundation as we get into these next phases and bring Florida back to where we want to have it. I think also, if you look at some of the other things we're going to be doing down the pike, we've tested almost 420,000 people now in the state of Florida. We have the 7 drive-through sites that have been operating for a while, including one at the Orange County Convention Center. But we're adding Pensacola, which had a soft open yesterday, large open today. We're adding Sarasota, Bradenton drive-through site, Naples, Fort Myers drive-through site, and then a hybrid drive-through and walk-up site at the Miami Beach Convention Center. So you're actually going to have more opportunities if you want to test, because we just feel if you're putting people back to work, and maybe a worker has some symptoms, they're hopefully in these communities easy way to do it. And that's, the drive-thrus aren't the only way. County health departments are doing it, doctors' offices. We're expanding it in many different ways, and I'll talk more about them in a second. But those drive-through sites are going to continue. When the federal government stopped supplying them, I called the mayor. I said, "You want to keep it, right?" He's like, "Yeah." I was like, "Well, we're going to keep it." So we've been happy to support that, and we're going to continue to do it. So we also, and you see it in Orlando here, and the county health department's done a good job, we've done walk-up testing community sites, and you set it up, People can walk up. You're able to reach out to underserved communities and offer testing in ways that are effective. So they've already done 10,000 tests just on different sites. They've done a number of different locations in Orange County, which we really appreciate. So we're going to continue strategically deploying walk-up sites when we can. And then we've also done the National Guard. I have these strike teams, 50 strike teams. They've been going out in the nursing homes. They've tested about 12,000 people in nursing homes just over the past few weeks. Clearly, that's the most vulnerable part of our society to COVID-19, so we're going to continue to do that. We also are going to be launching, hopefully early next week, a mobile lab in a converted RV. So you're actually going to have an RV from the Florida Department of Health, Florida Department of Emergency Management, and we are going to be able to do tests and then get a result within 45 minutes for people. So you can take this RV, you could drive it up to a long-term care facility, you could test the staff, test the residents, and then get them the results within a matter, each test 45 minutes, you do a certain amount of tests, but I mean really within a matter of hours, you're going to be able to get test results. So I think that's a huge force multiplier for us to be able to do that. So I hope to be able to announce that beginning of the week, but certainly next week we'll be able to do it. We also are seeing fruits from the decision that I made to let the licensed pharmacists administer COVID-19 tests. Very important to use all the tools at our disposal for this. So Walgreens just announced they're opening 9 drive-through sites in Florida, including 2 in Orange County, 1 in Orlando on Narcosuke Road, and then 1 in Winter Garden on Winter Garden Vineland Road. So those will be good. I think those will be convenient. CVS is also getting into the game. They haven't announced where their sites are going to be, but they're going to do it. And then so is Walmart. They're opening up 5 drive-through sites across the state through a partnership with Quest Diagnostics, and that's something that we look forward to. We also have a new machine that we're going to be debuting next week down in Miami. It's a machine to clean the PPE. So you can decontaminate these masks up to 80,000 a day. And if you decontaminate the mask, you can wear it 20 times, which in terms of this shortage, I mean, although I think the supply has started to flow a little bit better, but a month ago it was very difficult to get this stuff. But we have that so that it can be reused, and I think that that's going to be very, very important as we go forward. So I think that Orange County is really poised to help us move forward. We're going to be safe about it. We're going to be smart about it. It's going to require step-by-step approach. It's not something we can just flip a switch on, but I think that this is one community that's really showed you can get it done, and I know I look forward to continue to working with everybody here because I know there's so much that they have to offer. I give the mayor a chance to say a few things, and I'm happy to take some questions.
Okay, let me start by saying thank you to the governor for being here, and thank you to the small business owners who have joined us here today. We realize that really here in Central Florida, we are a significant portion of the state's overall economy. And we have been working with a team of dedicated public servants, business owners for the last couple of weeks to really offer advice to me as we reopen Orange County itself. And I have to thank several of the individuals who are here with us today who have been volunteering their time for that effort. In terms of Orange County, we have 1,413 plus individuals who have tested positive for the virus here within our community, and 34 people have died as a result of the virus. So what I'm saying to you is that we realize that this is a deadly virus, and as we reopen, we cannot forget our responsibility to make sure that we reopen in a very judicious way and a safe manner. And what I've heard from many of these small business owners here today who just happen to run barbershops and hair salons and nail salons, that they are committed to ensuring that as they, if they are allowed to reopen consistent with the governor's executive order, that they will do so in a safe manner. And for me, the guiding principle really is to ensure safety first and then the economic recovery next. And there's a happy balance between the two that we are trying to attempt to measure up to within this community. And I know that Floridians have that broad desire as well. And so as we move forward, we want to make certain that here within Orange County, these small businesses have all of the tools by which to be able to open up successfully. So we are the recipients of $243 million in CARES Act funds from the federal government that can be used for various things, but one of the ways that we intend to use those dollars is to help our small businesses acquire the personal protective equipment that they need to be able to open up safely. So we have ordered 1 million plus masks here within this community. Hopefully we will receive delivery of those this coming week and we'll redistribute them. And 200,000 different bottles of hand sanitizer that will also be redistributed within the community. Then we will look to use some of those dollars to assist small businesses with their recovery efforts. We have a technical team that's looking at that within our county that will hopefully come forward with a plan in the very, very near future. We're working with the Board of County Commission here to make certain that we make appropriate decisions as we do move forward. And I've had the privilege of talking to our surrounding counties. So here within the metropolitan Orlando area, our counties have endeavored to be consistent in our approach as we reopen. This issue regarding the reopening of hair salons and nail salons and barbershops is one that we mutually have said that we believe is the right fit for our community. It allows us to set the stage for further reopening. Now, during this period of time, we will be working with the Florida Department of Health, and Dr. Pino has been with us throughout this battle with the pandemic to ensure that we are looking at data to make certain that there's nothing that we're doing as we look to reopen that will adversely impact the overall safety of the people who live here. So it is important that the testing continues throughout the state of Florida, but certainly we are concerned about the additional testing here within our community. We have endeavored to increase the testing, and thanks to additional supplies made available from the state, we have been able to increase the number of testing sites here within our county. We have a major testing site that is open as we speak at the Barnett Park, where we are testing individuals today. So we want to reassure our community that as they are tested, they have the responsibility to then protect themselves and protect others in their families from the potential spread of the virus. And so while we see the numbers flattening here within Orange County, we're not rejoicing to say that this pandemic is over. I want to caution people that we're not there. This is still a very deadly virus, and our goal is to make certain that while the numbers are low in terms of the overall percentage of positives that we see from the test, we want those numbers to continue to be low and to ultimately get to zero. That is our goal within the community. So it is important that we reassess on a regular basis of how we're doing, and that takes several weeks between each phase. We're in the governor's phase 1 of his reopening process, and so we know that during this phase 1 period of time, before we're able to go to phase 2 and open up even more businesses, we have to make sure that the data that is provided by the healthcare workers supports that reopening. So again, thank you to the media for being here, for helping us to communicate the message throughout our community. And with that, Governor, I'm going to turn it back over to you.
Thanks, Mayor. And one other thing just on the testing, we've been, every day I'm trying to figure out when our antibody, we got a number of different companies that are shipping us antibody tests. We're going to have hundreds of thousands of those. We were hoping to get them yesterday. We were hoping to get some today. This is like, we're literally on the phone with the U.S. Department of Transportation about when this stuff will come in, can be delivered from China. I think it may be in the U.S. now how it gets to here. But the antibody testing will be very, very important because that will let us know who has already had the disease. And there's many people throughout the country when they've done these antibody tests who have been determined to have it. And many of these people didn't even know that they were sick when they had it. So if you're somebody in healthcare, you have the antibodies, well, that makes a huge difference in terms of how you treat patients. Also, even in something like this, if a stylist has the antibodies, just important information for us to know. So what I'd like to do is, once we finally get all that stuff in, some of these testing sites, we're going to start integrating antibody testing into the normal diagnostic testing. And the diagnostic testing is important, but look, you could test negative tomorrow. It doesn't mean the next week you're definitely going to be negative. I mean, that's a dynamic. If you have the antibodies, well, that's something you know you have, and that's really, really important going forward. All right, with that, take some questions.
Governor, I know you had said that you wanted to get to guests to open these kind of businesses. What do you think is a realistic timeline for you to get that?
Well, I think what we're going to do is we're going to take this back. I'm going to have my folks work on it. When we get back, well, I'm in there every day, but when everyone else is back on Monday, we'll do that and make sure that it's good. I want it to be vetted by different folks. So throughout this whole time, I've said I'd rather get it right than get it fast. It doesn't mean we're just going to sit on our hands, but we just want to be very thorough about how we're doing it.
Governor, given the guidelines towards having masks or recommending masks when people cannot socially distance, particularly in businesses, and maybe this is a question for both you and some of the personal services representatives, but how would you look at esthetician services, waxing or beard trimming, things where the client may not be able to wear a mask during the service?
Yeah, no, I think that that's something that we're going to have to think about. I'm not, I've never had a beard, so I've never done that or whatever, but obviously if you need to get there, it's just different. So we're going to have to look at that, and maybe we start with ways that can be masked first and then figure out how you move into that. But yeah, I would seek counsel on how that works.
Governor, when you were in Orlando last Sunday, you mentioned talking to someone about updating the state's dashboard so it distinguishes between total tests and individual tested. Do you still plan to do that?
Well, so if you look what they have now, so this is how they're doing it. They have here, so if you like Orange County, it's interesting. They can actually do this at a county. I mean, this chart right here is just phenomenal. So what it'll do is, so they'll do number and percent of positives. These count the number of people whom the department received lab results by day. The percent is the number of people who test positive for the first time, divided by all the people tested that day, excluding people who have previously tested positive. So that's the number that you look at, like for an Orange County. So they are doing that, and it's there. I would imagine if you had people retesting, that percent positive may look a little different. Who knows? It could be lower depending on where they're at, and then you'd have a few more tests. So that is how they're doing this percent positive. So that information's there.
But just a moment ago, you said 400,000 people have been tested, and we know that number is not true because that includes retests.
Well, no. So I think what you're seeing is we're at 450,000 tests, somewhere around there. So I would think that there's not enough people that have been retested. So I would imagine you'd probably have pretty close to that. I mean, so yeah.
Was 400,000 people.
Right, but we have 450,000 total test results, and we'll have 500,000 test results probably by Monday. So if you look, there's a lag in the test results. So if you have 450,000 results today, the people who have actually been tested are definitely more than the results we've had, because sometimes this takes like a week lag. So you're probably looking at, we will get results probably between 10 and 20,000 a day, for the next 4 or 5 days. And so those are people that have already, by this point right now, have already been tested for sure. We know that.
Please, hey, let's go behind you. You said 400,000 people. So why doesn't the state?
All right, I've given my answer. I understand this is important to you, but we've answered it. So.
Okay. Governor, just switching over to unemployment, is it true that the requirements for people to have to reapply every 2 weeks expires in the coming week, and are you going to continue to expand that?
So I'd have to look at when I did the order, but I think we did it for 6 weeks.
Yeah,
so we'll look at it. Here's the thing about that. It's really just they got to go on the site, click it, and so a lot of people were still doing it anyways. The reason why we did that was less because we were worried about people still being, we know they're going to still be unemployed in this period. It was to take some stress off the system, because as more people are going, it means fewer can be processed. What's happened, though, is that they've done so many structural changes for this that the system is holding up a lot better. Now, I'm still fine with extending it if we need to, but that problem today is a lot better than it was 4 weeks ago. What they did last weekend was because you can still go and apply on Pega, but they took down Connect from the public interface because they use it just to process claims. So they made last weekend, I think, between 450 and 500,000 payments by doing that. I talked to the DEO folks this morning, and they're processing again and doing that. So by the time we get to Monday, they're using this time to really make an impact there. So if I have to waive it, we'll waive it, but I'm not as worried about people going on and just clicking that button than I was, because you had a month ago, I mean, you had people would go on and the website was down like 75% of the time. So they couldn't physically even do it. So we didn't want a check to be held up because somebody wasn't able to click a button on a website that wasn't working.
Following up on unemployment, the Lieutenant Governor told us that you all would make sure that the eligibility concerns were looked into, because there were a lot of Disney employees who were auto-enrolled or had their auto-enrollment process, other folks who had their applications prepared by people who used to work in the unemployment office who were deemed ineligible, even though it seems that they meet all the criteria, weren't using PTO. Is that something that the administration has asked DEO to look into?
Of course. So I will hear periodically when I go to the press, hey, we just heard from someone that applied March 18th. They still haven't been paid. So then we have DEO look. If somebody is online on social media or in articles, DEO actually will go, they'll get the information, and then they'll try to look at that individual. And I think what they found is a lot of times you go in the system, the application wasn't complete, there was no Social Security, maybe they didn't have a job or weren't employed and so wouldn't be eligible. So there's all those different things. But I said, are people getting paid who applied like 2 weeks ago, but people a month and a half ago aren't getting paid? And they tell me that it's a automatic thing. Once you're processed through, it goes. They would not hold anyone back for any type of arbitrary reason. And so if somebody is still in the queue, it's because there's something that's not satisfied. And so that's what they're doing. But if somebody has all the criteria and they qualify under the law, then obviously they need to be processed. Understand, though, we cannot change the eligibility under the law. It just is what it is. So if you're not eligible for that, you then get kicked over. There's another part of relief from the CARES Act, which you can be. So you have the state unemployment, federal CARES Act unemployment, and then you have another pot of people who may just not have been working but need relief, and so you'd end up getting kicked over into that area. I want to thank everyone for coming out. I want to thank the mayor. I want to thank all these great folks, small business people. These are really important establishments, and we want to do what we can to get them up and running in a safe manner, and I'm committed to do it.